The process of an implant bridge is actually quite varied. We've been providing patients with implant bridges for over 50 years and it has evolved significantly. At this point in time, we have got three major methods. The first process for an implant bridge that I'd like to discuss is the conventional process. It is predictable, we know how it works, and we have a lot of experience with it. The process itself is split into several stages. The first stage is the removal of any teeth that are present. So we take out the teeth and then let the gum and bone heal for about 8 to 12 weeks. Exactly how long we wait depends on how fast that person heals. The person wears a denture for that period of time, if appropriate. The second stage then begins with some sort of CT or CBCT scan to evaluate the bone healing. We then plan the location of the implants, and you continue that second stage with the placement of the implants and then leaving the implants to heal and bond to the bone. Again, the patient has to wear some sort of denture if necessary. Once the appropriate period of time has elapsed, which is usually 2 to 3 months, we come back in a third stage where we actually assess how well the implants have healed and bonded to the bone before we start construction of the bridge. The construction of that bridge may take 2, 3, 4, maybe even sometimes 5 or 6 weeks to finish, depending on the materials that we use and the degree of complexity. So if you're looking at this conventional process overall, it can take about 7 months to get from start to finish. Assuming there isn't a lot of bone grafting required, there aren't large infections, because those sorts of things can actually extend treatment even longer, possibly up to a year. So with that length of time, why would you do this process? You would do it if you are a high-risk individual. That is a person who does not always heal well. So you may be a smoker, an uncontrolled diabetic as two common examples. By spreading out the treatment into 3 separate stages over time, we have the ability to do one part, make sure that it works before we actually move you on to the next stage. So it spreads out the risk and allows us to make sure that everything goes well and that we're building the next stage upon something that has worked well. The downside of this treatment, however, is that it takes significantly more time and you go through quite a lot of extra treatment because it's not all bundled together. And you have that denture as a temporary, and some people struggle with dentures. Some people have a propensity to gag, and so wearing a denture for 7 months or even maybe 12 months can be a big trial. The other major downside is cost. This is actually the highest cost way of getting an implant bridge because we are making some things that we end up throwing away and we don't have any efficiency or economy of doing things together. The second way of getting an implant bridge is often referred to as an immediate implant bridge. Now there are various trademarks around this. All-on-4 is an example. A more generic term is All-on-X. It is a more efficient way of getting an implant bridge than the conventional method I've previously described. This method came about because waiting 7 months for replacement teeth was a struggle for a lot of people, and the wait actually wasn't always necessary. Now the phrase immediate implant bridge is actually used fairly loosely here and by the profession because you don't actually get your implant bridge immediately. You get your implant bridge after the implants are put in, but it's not straight away. It can be 24 hours or even sometimes up to a week later. This treatment is carried out again in a couple of stages. The first one being planning. You properly assess things, you make sure this is the right thing to do. You look at the teeth, decide which ones have to come out. You look at the bone, decide how the bone needs to be modified as well. And once you've completed that basic planning, you then remove the teeth and put the implants in. Bone reshaping is actually very common and is done at that point. So at that same surgical visit, the clinician usually takes some sort of impression. Using that impression, they then go away, make some models, and maybe later that day or possibly the next day, a test run is made by a laboratory, and that test run is popped into your mouth. Now it's actually quite challenging at this point because you're often numb, swelling has started to take hold, and it can be a bit uncomfortable. Your gum isn't necessarily in the right shape either because it hasn't healed. So trying to decide whether or not this test run is just what you need is sometimes a bit uncertain. However, once you've decided that you're okay with things, the bridge is made. And the bridge may take 24 hours to make, may take 48 hours to make. It depends a bit on the laboratory and the support your clinician has. It also depends a bit on what sort of materials are being used. But you come back at least the next day or possibly a couple of days later and have your bridge put in. So when you look at this overall, from the time of surgery, the first surgery, to the time you get your teeth, be at least 24 hours, if not more. Could even be up to a week before you get teeth. And the teeth may be temporary teeth, they may be definitive teeth, it just depends. So whilst the profession and the dentists call this an immediate implant bridge, it's not actually an immediate implant bridge, it's more like an almost immediate implant bridge where you take your teeth out and get your replacement teeth a while later. Why this is a good thing, or why the advantage of doing this all on X method is that compared to the conventional process, you actually do get your teeth sooner because you're not waiting 7 months. The downside, however, is that you still put multiple steps together and you are still taking a bit of time and it's not immediate. You're also, when you combine treatment, putting risk together. So you're combining the risk from the tooth removal and healing, and the implant placement and healing, and lumping it together so that the chance of something not working is actually slightly higher than doing it in steps. And if something doesn't work, the consequences are much greater because the bridge is already made and you may have to dispose of that bridge and do it all over again. The third way of getting an implant bridge is a method called all at once. Again, this is a trademark term for a very particular process. With this process, the first stage is planning. In contrast to the two other processes, the conventional and the all on X, all at once requires a lot more planning because everything is going to be done together. The key to success of this treatment is to plan, and then plan some more. We need to correctly assess whether you've got enough bone for the implants, if any grafting is needed and where it might go, where are the teeth going to bow, what shape of teeth you might like, colour, cat, and so on. So there's a lot of planning that goes into this, which is why it takes just a little bit longer before you can have the treatment. But that initial wait is well worth it, as you will come to see. Once we've got the planning done, we actually make the bridge. So you are then able to see that implant bridge before you have any surgery. You can look at it, touch it, feel it, get explanations about the different aspects of it and what you need to do to look after it in the short, medium and long term. Unfortunately, we can't actually put it in your mouth until the teeth are removed, but we do use several simulations so that you can see it virtually. The second stage of treatment is then to have the failing teeth removed, the implants put in and the bridge put in. This is all in one visit. Typically the visit might be 1.5 to maybe 2 hours long, depending on the degree of complexity. But essentially you go in to the clinic, you have your existing teeth when you go in and you leave with your new teeth in usually under 2 hours. And this is the main point of difference of the all-at-once process and bridge compared to everything else. So by putting in the all-at-once bridge straight away, you can go home after surgery and you don't have to come back the next day or a couple of days later. You actually typically come back after a couple of weeks. Once you've had a chance to recuperate, recover, swelling disappears, and then we can adjust a few things and make sure you are going well. The limitation of the all-at-once process is that we are bundling risk, just like all on X. We are combining steps, and there's a small risk that something may not work out with one of those steps, and so overall there's a slightly higher risk than the conventional process. The second issue, or limitation, is that we can't put the bridge in your mouth before we take your teeth out. So you have to rely upon the simulations to make sure the teeth are in the correct location and that you're going to be happy with the appearance. So if you're going to do a direct comparison between the conventional process, all on X and all at once, the major differences are risk and time. The conventional process is the lowest risk, but takes the longest time. All on X, all on 4 is higher risk, but a shorter treatment time, which might be 1 to 7 days, depending on the person and their process. All at once, again, is a slightly elevated risk. However, you get your teeth straight away. Now, how you choose between these three options depend on what you value most. Whether you are willing to tolerate some extra risk versus whether you want to have the most convenient process and the least time in the dental chair. If you want to take minimal risk, then we steer you towards the conventional implant bridge process. If you value convenience and time saving, then we would steer you towards the all-at-once option. Now, this is a major decision, and taking time to educate yourself and discover what is best for you is very important. We hope that this has been helpful in that process and journey, and we look forward to helping with you with a confident new smile.